Hello, my name is Taiwo, and I'm excited to be presenting my topic on traumatic brain injuries' increased prevalence in different regions. To start, a little about me. I'm a rising senior at Winslow Township High School. I'm the co-president of my school's Model UN and vice president of the National Spanish Honor Society. I'm a UCLA Health Youth Ambassador and fundraiser. I'm a biomedical science researcher at Renat University focusing on cell death and autophagy. I'm a published independent researcher on the topic of traumatic brain injuries, long-term changes on one's personality. I'm the co-founder of an awareness website and social media, FemCare Equity, to highlight medical disparities in women. And I'm passionate about biomedical science, public health, and neuroscience. Introduction. Objective. Highlight the disparity in how the region one lives greatly increases their chance of getting a traumatic brain injury, increasing their chance of death. Discuss preventative measures to decrease the rate of traumatic brain injuries in high-risk countries and promote medical access. What are traumatic brain injuries, also known as TBIs for short? External force injuries to the brain or head due to incidents such as vehicle collisions, sports injuries, and falls. The World Health Organization reports approximately 69 million people suffer from TBIs yearly. TBIs range from mild concussions to severe intracranial hemorrhage. Effects can lead to increased risk of dementia and temporary to long-term personality shifts. Global inequality rate on TBIs based on region. The World Health Organization states the highest rate of TBI injuries fall in Southeast Asia and Western Pacific regions, as well as Africa. The countries in these regions include Indonesia, Thailand, Myanmar, India, Bangladesh, Nigeria, Kenya, Ghana, among others. Comparatively, the people in the smallest amount of TBIs come from North America and Latin American countries. Look at the graph. The cause of TBI from road collisions occur frequently in Southern Asia and all of Africa, which leads into the next point. Primary reason this disproportionately affects certain countries. According to the World Health Organization, in developed nations, TBIs affect the most individuals aged 65 and older. In other nations, TBIs affect the most individuals aged 18 to 30. South Asian and African countries make up the majority of yearly TBI injuries, big part in due to traffic collisions and unsafe roads. South Asia and Africa have one of the worst road infrastructure in the world. Here we see that countries studying Europe and North America are red because the biggest cause of TBIs there are falls, making the biggest age group dying from TBIs the elderly, while countries in South Asia and Africa are green or yellow because the biggest cause for TBIs there are traffic collisions and road accidents, and the biggest age group dying from TBIs are youth. This chart highlights the percentage of cause such as falling contributes to the overall cases of severe TBIs in that region. In Central Sub-Saharan Africa, for example, we see that motor and pedestrian road injuries are around 80% of severe TBIs in the region, the highest out of all the cases listed. And with South Asia, they both lead in the percentage of moderate to severe TBI cases, with close to 60% of them, while the lowest North America and tropical Latin America have percentage of 30% of TBI cases being moderate to severe. Another reason for this disparity, researchers at Cambridge University found that countries in low, medium human development index, or HDI for short settings, have higher percentages of death after traumatic brain injury. High HDI countries have lower percentages of deaths after TBIs due to better access to good medical technology and well-trained staff. Human Developmental Index measures countries in either high, medium, and low rank by their citizens' overall standard of living, with high being good quality of life and low being poor quality of life. Countries in South Asia and Africa are low on the HDI scale, and the lower the HDI scale, the higher the chance for youth to get severe traumatic brain injuries and road collisions and die from them. Prevention and how to aid in decreasing disparity. The International Road and Assessment Program states that improved road design and safety features reduces the chance of TBIs from crashes by 20 to 30%. Through organizations that support road improvements in these at-risk regions, it can help to ease the amount of TBIs from road accidents and help to decrease the amount of youth dying from an avoidable death. Organizations such as Traffic Injury Research Foundation, Southeast Asian Road Safety Network, African Road Safety Organization are international regional organizations that help research and fund infrastructure that help promote road safety. Additionally, Doctors Without Borders is an organization that allows doctors to go to other countries that are in dire need of proper medical professionals. Through this, low HDI and high risk TBI countries can be able to obtain the medical professional help they need to help individuals in this region get the help they need. Lastly, individuals not from these regions can help by supporting these causes through donations and vocal support and advocacy to bring the issue to light as it is not well known. Through advocating and legislation for proper road safety and help protect youth from an easily avoidable situation. Conclusion: traumatic brain injuries are external injuries to the brain that can have lasting detrimental effects. TBIs disproportionately affect individuals living in Africa and Southeast Asian countries, in part due to dangerous and undeveloped roads and unqualified medical professionals. It is important to promote the use of improved road infrastructure to decrease TBI death in these regions, as well as increase the amount of trained professionals to deal with these types of cases. Lastly, it is important to support these road safety initiatives to decrease the amount of TBIs globally, as well as advocate for proper road safety and legislation. Thank you. Here are my references. And lastly, I would like to acknowledge all the important people that have helped me make this project. First, I would like to thank the organizations of the Global Health Leaders Conference for giving me the opportunity to present my topic. I would like to thank the attendees and other people for listening to my presentation. And lastly, I want to thank my research mentors at Rayhan University and Teens in Health for allowing me to pursue this project. Thank you for listening, and if you have any other questions, you can contact me via my email or my LinkedIn. Thank you.